Hello everybody, it's a pleasure to be presenting in front of you today. I'd just like to dive straight in and assume that we all understand the devastating consequences of cancer. However, we do know that detecting cancer earlier leads to better patient outcomes and increased survival rates. Though current early detection tests are highly invasive, such as mammograms, cervical smears and colonoscopies, and therefore have a low compliance rate. Though this is changing with the discovery and development of liquid biopsy-based clinical assays. These are assays capable of detecting cancer from minimally invasive blood, urine, saliva, and even fecal tests. However, current tests on the market suffer from low sensitivity for early stage diagnosis such as pre-cancer or stage 1. And the development of these tests is incredibly expensive, time consuming, and there's a lack of technologies available for the discovery of new markers of disease from these types of samples. My name's Jack Kennefick and I'm CEO and co-founder of Tagomics Limited. And Tagomics is going to transform the way disease is diagnosed globally. We're going to do this using our innovative platform technology to discover new markers of disease and develop these markers into world-leading clinical assays capable of detecting, diagnosing, and monitoring disease from simple non-invasive blood tests. Tagomics technology interprets the epigenome, which is a series of chemical modifications to our DNA that control which of our genes are switched on and which of our genes are switched off. Understanding this second chemical control layer allows us to diagnose disease earlier and also locate the tissue from which the cancer came from, so that more tailored and targeted treatments can be given to the patient. The targeted and scalable nature of Tagomics technology allows us to economically discover more robust and reproducible disease markers for the development of the next world-leading clinical assays. Tagomics is supported by a strong core team. Myself and Dr. Robert Neely co-developed the technology and founded Tagomics, and we've since brought on board the wealth of commercial and sector-specific knowledge of our director Jason Mellard and also Joe Hay and Simon Ward. This has all been made possible through the RSE Enterprise Fellowship. It's increased my business understanding massively and allowed me to do things like incorporate our company Tagomics, negotiate for IP, build our team, and we've even recently entered on to the UK's leading healthcare accelerator program, Start Codon. Tagomics' next steps are to raise an additional £300,000 on top of the £250,000 given to us from Start Codon to develop our standard operating procedures in the laboratory and generate clinically relevant proof of concept data that we can then approach our already interested partners with in order to begin development of our actual clinical assays and take these to market. If you have any questions, please do let me know.